And welcome into To Your Health as we get into the month of February. Valentine's Day is made for love. Love comes from the heart, but it's also National Heart Month, where we want to make sure you're having a healthy heart. So, Dr. William Cook is with us today, and you're a thoracic surgeon working with Baptist Health System here now.
Yep.
And Dr. Cook, as we start to grow old, I'm starting to look a little bit gray at the top, and a lot gray actually, not just a little. But inside of us, we have a heart and we have a vascular system. Does that age also?
Yes, it does. The blood vessels are active in terms of clearing cholesterol out of our bodies. Even children have fatty streaks in their arteries. And as we get older, the fat streaks stay in the same places, and they can start to get hard and narrow. In general, if somebody has disease in the blood vessels of their heart and they're over 60, it's not premature. It's normal wear and tear. So
Yeah, because we often heard the word, from my generation at least, it was called hardening of the arteries. Yeah. And that's basically then the plaque buildup, isn't it?
Yeah, that's end stage. It starts off as soft, and over time, any kind of thing, when you have inflammation, which is how you get rid of the cholesterol in the blood vessels, it turns hard, and it can turn into, it gets calcified. Lymph nodes can do that with chronic infections as well in the lungs, but in blood vessels, they eventually get hard.
And many years ago, almost 20 years ago, I had a 6 bypass on my system here. And everybody said, "Oh, you had a heart attack." And I said, "No, I didn't have a heart attack, but I had all my vessels were clogged up." Is that true? True statement?
Yes, you don't have to have a heart attack to have chest pain. And that's why you want to get treated as early as you can when you start having chest pain. And why we do the test to find the disease of the blood vessels when we can fix it before it hurts the muscle of the heart.
And a lot of times you'll go to your cardiologist first when you're starting to have any kind of discomfort, and then they can do a number of things. They can do a stress test, which it's easy to do. A lot of times people get concerned about a stress test, but it's a very easy procedure. But then you may have to have a heart catheterization to find out more about your problem, right?
Right. The test, like any kind of test, and you can go to your primary care as well when you start to have it if you don't have a cardiologist yet. In the first times, if you have any kind of chest pain or shortness of breath, usually with activity is more of a red flag than when you're laying down. Laying down can be reflux, but the chest pain and the typical pain going to your shoulder or jaw only happens in about 60% of men and only 40% of women. Because our insides, the nerves aren't like our skin. It's not one-to-one. You can't tell where pain's coming from. That's why you can't tell if it's reflux or your heart. And so shortness of breath with activity that has changed, or noticing that you're decreasing your activity, are things you need to tell your doctor about, where they may consider a stress test. The stress test is a good screening tool. It's not very invasive. You just do an EKG while you're walking to make the heart need more oxygen to see if it's not getting enough. And so that's the earliest way we can tell as to whether or not things are starting to become a problem.
And if it looks like you need a heart catheterization, that's even gotten, I'm so amazed at the fact that probably even doing bypass surgery as well as a heart cath is becoming a little bit easier to do now, isn't it? I don't mean easy from your perspective, because you've got a lot of responsibility on your back, but my heart catheterization, they went up through my leg, and I think right now, don't they go up through your...
They can't, in most people, these arteries are big enough, and they got the catheter smaller and smaller. It keeps getting smaller, and so they can frequently do it through the radial artery, especially if they don't need to put any stents in, if they're just looking to see what's there.
Right.
So,
if you need stents, obviously you need more of an area.
Sometimes, once again, sometimes. Like I said, they keep getting better and better, all the catheters that they have, so they're able to do more and more through the radial artery. So.
And then obviously when you finally get to the point that you need the serious work done, then you come to a surgeon such as yourself, because you're going to take care of thoracic, and it's always the heart, the vessels, and the lungs. Yeah, that's a very important part.
Right. Yeah. No, well, right. From my standpoint, the lungs are something I also take care of, and smoking's terrible for everything in there, blood vessels and lungs, so I'm a big anti-smoker. But but the heart, if you get two vessel disease that involves the main one on the front of your heart way up high, or three vessel disease, then people do better with surgery. And so you get and there's some areas where stents won't work if you have a split, and you have to decide which vessel you're going to clog off and which one you're going to open. You know, sometimes there are technical reasons they can't do stents, and you need to go to surgery.
And recovery from bypass surgery is very simple right now. I think, from my perspective, it was. And I had 6 bypasses in the end of December, and by the 3rd week in January, I'm back at work.
Yeah. Yeah,
But you have to do what the doctor tells you to do.
right.
You got to be walking a mile the next time I see you.
Yeah, it's important to put in the time up front to heal up,
Absolutely.
you know, and that's your best chance to heal it up is up front.
That's right.
But most people, after open heart surgery, the day of surgery is day 0. For some reason, that's just, we've always started
Right.
with post-op day 1, and then we go from there. But most people are in the hospital 3 to 5 days after surgery. You know, we try to get them up and walking. It's better to
Yes.
be walking than not. And the main thing is waiting for the bone to heal up, the breastbone to heal up. And we can't put people in a cast because they have to breathe.
Absolutely.
Otherwise, we would just saw it off in 8 weeks. They need to give us 6 to 8 weeks and not lift in anything heavy.
Well, that's great. Well, Dr. Cook, it's so good to have you back in Montgomery.
Oh, thanks.
I know you were here a number of years ago. Welcome back home, because this
Thanks.
is going to be home for you now.
Definitely. Great to be here.
Thank you. And just remember, as Dr. Cook said, don't be complacent if anything is bothering you with your heart. Go ahead and get it checked initially by your primary care doctor, and then if you need to, you go to a cardiologist. And we'll be right back right after this.